Fox 5 and Hot 97 present Street Soldiers with Lisa Evers.
I'm so glad you're joining me for this episode of Street Soldiers on our prison system and COVID-19. The pandemic has turned our daily lives upside down in so many ways, but at least we have our freedom. For those who are incarcerated, there are additional stress factors, as well as for their loved ones. And it's not just inmates. The health risks of being behind bars and enclosed spaces are being felt by corrections officers and staff as well. We know the drill now about social distancing and avoiding large groups in our everyday lives, but these basic precautions are nearly impossible behind bars. That presents a unique healthcare challenge, says Dr. Jen Caudle.
There are a number of risk factors. We first think about jails and prisons being places where there are lots of people. And not only lots of people, but lots of people likely in a very confined space.
The danger was all too real in the New Jersey state prison system, which was ranked #1 among state and federal systems for COVID-19 inmate deaths last spring. It remains among the highest in the nation, with more than 50 inmate lives lost to the virus. To mitigate the spread, over 2,250 inmates were released right after Election Day due to a bill co-sponsored by State Senator Nellie Poe and signed by the governor.
It allowed them to be able to reduce their stay for health reasons by 4 months from the time of which they were actually going to be released from prison.
Those eligible for early release include inmates convicted of serious felonies. Assemblyman Kevin ROONEY opposed it.
Again, respect what these criminals have done as far as putting time in, but not release them into the general public until such time as we can ensure their safety, the safety of the public.
The New York State Department of Corrections and Community Supervision, DOCS for short, says through the end of October, there have been 18 deaths of those incarcerated and 5 staff. More than 20% of the inmate population has tested positive for COVID-19, along with nearly 1,500 staff members. When you're the one inside, it can be stressful.
Everybody's going to be susceptible to it. I mean, like domino effect.
Correctional officers control whether they have access to the supplies that they need. They control whether they have access to masks. They control whether or not they're in congregate areas and can socially distance. So unless correctional officials and correctional staff take seriously the needs of our clients, there's no real way for our clients to protect themselves.
DOC spokesperson Thomas Maley tells us they are providing masks to inmates and taking isolation and quarantine measures as necessary. Maley says DOCS is in the midst of targeted testing of the entire incarcerated population in the state's correctional facilities. Testing of the entire incarcerated population is expected to be completed by November 15th. Hopefully one day we can get corrections officers on our show. For now, let's check in with our panel and find out what they have to say. Joining me for this conversation is STEFEN Short. He's a supervising attorney of the Prisoners' Rights Project for the Legal Aid Society. STEFEN, great to have you with us.
Thanks so much.
Thank you so much. Also joining us is Charles Tucker Jr. He's a criminal defense attorney and a partner with the Cochran Law Firm. He's also the author of a new book called The Five Brothers. Charles, great to have you with us.
Thank you, Lisa. Nice to be here.
Thank you. Also joining us is Sol B. He's formerly incarcerated. He is a reformed gang member, working dad, and community advocate for the youth now, and co-host with his wife, Isha J, of the hot podcast, Hustle and Love. Sol B, great to have you with us.
Bye, Lisa.
Thank you. STEFEN, one of the issues is we saw on the outside, just in society in general, extreme shortages in the early months of the pandemic of just basic things like sanitizers were being sold at jacked up prices. We have heard reports that in some of the city jails, inmates did not have soap. They did not have some of super basic cleanliness things. What are you seeing in terms of the availability of cleaning supplies, sanitary things, and sanitary precautions in the state system?
Right, so we know that, prisons are notorious for not providing the type of supplies that incarcerated people need, and certainly that's the case today. Certainly that's the case, and it's been the case throughout the pandemic. So, we've been litigating basic conditions issues in state prisons since the 70s. I can say that when it comes to COVID-19 and when it comes to hand sanitizer, early on, incarcerated people were essentially forced at certain prisons to manufacture hand sanitizer for, 3 cents an hour, for absolutely ridiculously low wages. And even those products were not provided to the incarcerated people that made those products. So at a lot of facilities, we were pushing superintendents and pushing the department to provide hand sanitizer when we knew that hand sanitizer was being manufactured by our clients, right? And that continues today. At many of the facilities, hand sanitizer is not provided. The same thing with masks. You know, we're told that folks are being provided one mask and being forced to use that mask for an extended period of time, even after it's dirty and no longer adequate. Again, that's not appropriate, right? I mean, masks are the most basic protection against the virus. And, you know, it goes on and on. Other cleaning supplies, other hygiene supplies. Folks lack the ability to clean their cell in their area. Folks lack the ability to, you know, clean common areas, and there's lots of congregation that happens in those areas. So it runs the gamut. I mean, from hygiene supplies, cleaning supplies, masks, you name it. There are both shortages and refusals to provide things.
Charles, in terms of the interconnection with society, because there are those, what do you say to those people who go, well, you know, they're behind bars because they were found guilty of doing something wrong, so we don't really need to worry about them, and yet we see prison staff, there were visitors, family members, our friends and relatives who would come in, and you can't isolate a certain population no matter how bad you try. What kind of rights do inmates have? What kind of constitutional rights do they have that may be being violated?
Well, I think the violations are highlighted or even heightened under these extreme conditions. I mean, when you look, there's no national response, you know, for those of us on the outside, and you can see the challenges a lot of us face. You know, you can see the outbreak, you know, taking a rise in a very accelerated fashion. Imagine incarcerated individuals and those sitting in prisons who are falsely accused. Let's not forget those individuals.
Right.
You know, a lot of times people say, oh yeah, you know, there's almost a culture that those individuals who happen to have fallen short, you know, they deserve less. So less is given to them. And so a lot of times the rights that, you know, myself and great individuals like Attorney Short, we're fighting for are basic rights, not even like something
like basic human rights, like you're a human being, right?
Can my client get a phone call to call his family? You know, he's doing his time. Can he get a simple phone call to call his wife? I have a guy who's incarcerated in Supermax. He hasn't been able to speak to his wife, or he has the privilege of having several wives, but you know, he hasn't been able to speak to at least 2 of them for over 2 years. You know, like basic rights is what we see being violated, as well as a compromise to basic safety protocols that should be afforded to every citizen.
So it'll be one of the measures that that were taken in New York State and in other states around the country is early release of people being released due to the coronavirus. But in terms of when you're behind bars, and also the other measure they took was to lock down, prevent visitors from coming in for a long time in the federal prisons. What does that do to you when you're behind bars and you can't have any visits and you can't get information, and you know something is going on that could possibly take your life that you have no control over? Take us into that mindset of somebody who's behind bars facing that.
Well, technically, if you apply, you know, being in, you know, the closeness of the cells are not 6 feet, number one. So if the virus is contracted by an inmate, the next door individual, like I said, if something comes into the cell block, as I was explaining to you, like the flu, everybody's going to be susceptible to it. I mean, like domino effect. One guy. So now when you're talking about something is as lethal as the COVID, and these superintendents practicing these draconian policies where they don't really care, honestly, because if they did, they would take this measure, but they feel you're in prison for murder, you're in prison for robbery, you're in prison for rape, you're in prison for whatever. You know, I'm here first, security. That's why a lot of these preventive measures are not being, you know what I'm saying, active immediately, because first is care, custody, and control. Then your health comes next.
Right.
So that's the main thing, the draconian power of security. They don't believe that you should have that. And then the police is bringing it in. If you're in 30 years, how could you contract COVID?
Right. It's obviously somebody coming in, or somebody having that.
Of course. Yes, it's like right out of a science fiction book, man. I don't know, man. It's just crazy because here these guys is just, they're just sitting there in a cell. They're letting them out like periodically. The ventilation, all the things that say airbound that allows you to contract the COVID are there already.
Right.
For ventilation. You know what I'm saying? Windows, no air circulation.
Right, exactly. Everything that we're supposed to do to mitigate it and make it better is, to make people safe. Stefan, in terms of the New York State prisons, have you been seeing certain patterns emerging? And, because we have heard about these early releases. In fact, this became kind of a political football for various candidates and various elected officials. But are there certain patterns that you see throughout the New York State prison system?
Well, I mean, on the issue of releases, I think the pattern is a total lack of response and failure to meet the moment by the state. I mean, that's been the pattern since April. We identified well over 200 individuals for the Department of Corrections who were extremely medically vulnerable or of advanced age and eligible for some form of release to prevent, their contracting COVID-19. And unfortunately, only 3 clemencies have been granted by the governor since the beginning of the pandemic. Medical parole is essentially unused by the Department of Corrections and by the governor to this point. And that's the pattern on the part of the state. I would say the pattern in the facilities is spikes that appear to be isolated, but maybe aren't so isolated because we don't have the testing data to really show what the impact is across the state. And I also wanted to touch on a couple of points that Charles and Sol B made, just to say that this is the epitome of a community problem, right? You have communities, correctional officials and correctional staff, and incarcerated people who are all being impacted by this airborne pathogen that spreads quickly. And the political issue around people who are convicted of crimes and people who are in prison and this idea that they deserve less is at its utmost absurdity in this situation, where if we don't provide incarcerated people with the care that they need and the cleaning and hygiene products that they need and the protection that they need, they're going to infect staff. We're going to infect communities around the facilities. We're going to have serious issues. And that's right. That's exactly what has happened in Greene County. That is happening in the Elmira area right now. And so this is an opportunity for people to come together for prisoners' rights issues because it benefits everybody. And that's the narrative that we have been pushing since the beginning of the pandemic. And we're waiting. We're waiting for the state to take that seriously.
We'll be right back with more on COVID-19 in our prison system. And Charles, as they talk about trying to control the spread, we've seen outbreaks in the middle of this second wave. There's also been an issue with city jails too, where you have people coming in, some people going out. Well, not as many as before when the courts were completely closed. But in terms of the strategy, there seems to be no tracking either. There seems to be a big shortage of that.
Well, again, it comes from a lack of a nationwide mandate, right? Nationwide direction. To Stephen's point, that governor, stands as one of 50, right? So imagine if you had a situation where the federal government is ordering the governors to be accountable for their own states and say, okay, look, let's start moving forward with getting these individuals released. We have these facilities, let's do right by them. And in a lot of respects, some of these facilities should be shut down. They should have been shut down. I could say Rikers is one. There's a bunch of facilities in Mississippi. My partner, Carlos Moore, was fighting before the pandemic broke out, where you had one of the facilities in Mississippi where 27 inmates have died. That was pre-pandemic because of conditions, guards allowing riots to take place and other, that would cause the compromise of the safety of inmates. So we really have to look at a total restructuring of our prison system. Let's create a situation where the incarcerated feel safe, even outside of the pandemic. The pandemic has just caused it to be a playground, where a feeding ground for the virus, and taking out bodies left and right, even putting the guards at risk at high levels.
And then they take it home to the community, to their family.
So it's no wonder. I mean, I don't need to be Dr. Fauci to figure out why we see the numbers decline and then you all of a sudden see a spike.
So Solby, we've heard a lot too with coronavirus about pre-existing conditions like people's age, but especially things like asthma, things like diabetes that are very common, especially in our communities. In terms of ongoing medical care, is there somebody, if an inmate feels sick, that they can talk to or that they can raise a question about and say, listen, I need some help here, like your friend with asthma?
I'm gonna tell you, the quickest way for you to get a medical response is mental health. If you say, well, because of I'm feeling suicidal, they're on it. But as far as just, my chest is hurting, my heart, all right, put in for sick call. You're gonna wait. Sick call may not be until 3 days later. So unless it's a death-threatening emergency or it's a mental health issue, because mental health is separate in itself. So if you don't use those measures right there, no, you're not going to be. And I agree with both brothers, is that these governors should implement before security, the health safety, as he said, the CDC or whatever he said, implementing in society. Because these superintendents, from my personal experiences, only thing they care about is care, custody, and control. And they're going to use that because the courts have, if it's a security factor, they have overruled a lot of situations concerning health, concerning your life with the riots and or whatever. So I believe that, as the brother said, legally, these governors should begin to implement health first. In this point, we're not saying overall, we're saying right now, or the community, the brothers inside, and the prison guards are going to be affected.
And so, in terms of what people can do to support, to support equal justice for everyone and respecting the human rights of those who are behind bars, what would you like to say to people?
Well, first and foremost, I can understand what Charles is saying, because I was a direct victim of those inhumane, draconian process, the 30 years that I did, and from my own personal experience, even in modern times, these were things that were practices before prison reform, when they were really penal systems, the penitentiary. So you realize in the modern time, are these things still being practiced? From a personal standpoint, yes. These brothers have no human rights. You're not looked as a human being under those circumstances. I don't know why. What's the psychological effect of docs, how they indoctrinate their correction officers, but they don't see you. They see you as us and them. Now, when you're in the street, you're a regular individual. But when you're locked behind those bars, no. They don't see you as an actual human being, and they perpetuate that every day. So with this COVID thing, this health thing, I just see brothers as is, like getting sitting ducks. You know what I'm saying? At the hand of the government. I mean, what else could they do? They have no outlets. Everything is controlled by the powers that be. You can't talk to your lawyer. You can't call your family, all in the name of security. So I believe that the governors should at some time deviate from that and focus on what is, because it's affect us in as well as out here in the community.
All right, and STEFEN, in terms of legal actions, does Legal Aid Society, does your project have any actions that are pending or planning?
Yeah, we have filed multiple writs of habeas corpus to try to get people out of prisons and jails during the pandemic. We've met mixed success in the courts. We have several still active cases. We have some cases that are on appeal at this point. And we're gonna continue to push the courts to address the pandemic and address issues related to the pandemic. But one thing I'll say is that these types of revolutions do not happen in the courtroom; they happen in the streets. Right. So we're going to continue to call on people to get out into the streets, and to, once you're out in the streets, demand a major restructuring of the way we deal with social problems and criminal justice issues in our society. And that means taking funds and resources away from systems of state violence and directing them into the kind of systems and interventions that build healthy communities. That's what this moment is about. And, you know, when we're not in the courts, we're in the streets fighting for those things. And that's the battle.